What's going on, guys? It's Nathan over here, and today we'll be talking about sickle cell anemia. Overview. What is it? It's one of a group of inherited disorders known as sickle cell disease. It affects the shape of red blood cells, which carry oxygen to all parts of the blood. All parts of the body. Red blood cells are usually round and flexible, so they move easily through blood vessels. In sickle cell anemia, some red blood cells are shaped like sickles or crescent moons. These sickle cells also become rigid and sticky, which can slow or block blood flow. There's no cure for most people with sickle cell anemia. Treatments can relieve pain and help prevent complications associated with the disease. Some symptoms. Signs and symptoms of sickle cell anemia usually appear around 6 months of age. They vary from person to person and may change over time. Yeah, this is like a rare disease, I think. I'm just trying to get information out there so you guys can maybe like see the signs, or I'm not a doctor by any means. I know I say this in every video, but I just want to spread awareness of all the different disorders and everything like that. If you guys have recommendation videos, just let me know down below. Anemia. Single cell break apart easily and die. Red blood cells usually live for about 120 days before they need to be replaced, but sickle cell typically die in 10 to 20 days, leaving a shortage of red blood cells. Without enough red blood cells, the body cannot get enough oxygen, and it causes fatigue. Episodes of pain. Periodic episodes of extreme pain called pain cries are a major symptom of sickle cell anemia. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joints. The pain varies in intensity and can last for a few hours to a few days. Some people have only a few pain cries a year, others have a dozen or more a year. A severe pain crisis requires a doctor's stay. Some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bones and joint damage, ulcers, and other causes. Swelling of hands and feet. The swelling is caused by sickle-shaped red blood cells blocking blood circulation in the hands and feet. Frequent infections. Sickle cells can damage the spleen, increasing vulnerability to infections. Infants and children with sickle cell anemia commonly receive vaccinations and antibiotics to prevent potential life-threatening infections such as anemia, delayed growth, or puberty. Red blood cells provide the body with oxygen and nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and child and delay puberty in teenagers. Vision problems. Tiny blood vessels that supply the eyes can become plugged with sickle cells. This can damage the retina, the portion of the eye that processes visual images, and lead to visual problems. When to see a doctor. See your healthcare provider right away if you or your child has symptoms of sickle cell anemia, because children with this disease are prone to infections, which often starts with a fever and can be life-threatening. Seek prompt medical attention for a fever greater than 101.5 Fahrenheit or 38.5 Celsius. Seek emergency care for symptoms of stroke, which include one-sided paralysis or weakening in the face, legs, or arms, confusion, difficulty walking or talking, sudden vision changes, unexplained numbness, and severe headaches. What are some of the causes? Sickle cell anemia is caused by a change in the gene that tells the body to make the iron-rich compound in red blood cells called hemoglobin. Hemoglobin enables red blood cells to carry oxygen from the lungs through the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky, and mishappen. For children to be affected, both mother and father must carry one copy of the sickle cell gene, also known as sickle cell trait. and pass both copies of the altered form to the child. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait. With one typical hemoglobin gene and one altered form of the gene, people with the sickle cell trait make both typical hemoglobins and sickle cell hemoglobins. Their blood might contain some sickle cells, but they generally don't have symptoms. They're carrier of the disease, however, which means they can pass the gene to their children. Some risk factors for a baby to be born with sickle cell anemia: both parents must carry a sickle cell gene. In the United States, sickle cell anemia most commonly affects people of Africa, Mediterranean, and the Middle Eastern descent. Some complications can lead to a host of complications, including strokes. Single cells can block blood flow to an area of the brain. Signs of strokes include seizures, weakness or numbness of the arms and legs, sudden speech difficulties, and loss of consciousness. If your child has any of these symptoms or signs, seek medical treatment immediately. A stroke can be fatal to someone with this disease. Acute chest syndrome, a lung infection or sickle cell blocking blood vessel in the lung can cause this life-threatening complication, resulting in chest pain, fever, and difficulty breathing. It might require emergency medical treatment. Pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. Shortness of breath and fatigue are common symptoms of this condition, which can be fatal. Organ damage. Sickle cells that block blood flow to organs deprive the affected organs of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen. The lack of oxygen-rich blood can damage nerves and organs, including kidneys, liver, spleen, and it can be fatal. Sickle cells can be trapped in the spleen, causing it to enlarge and possibly cause belly pain on the left side of the body. This can be life-threatening. Parents of children with sickle cell anemia should learn to regularly feel their child's spleen for enlargement. Some blindness can occur. Sickle cells can block tiny blood vessels that supply the eye. Over time, this can lead to blindness. Leg ulcers. Sickle cell anemia can cause painful open sores on the legs. Gallstones. The breakdown of red blood cells produce a substance called bilirubin. A high level of bilirubin in the body can lead to gallstones. Priapism. In this condition, men with sickle cell anemia can have painful, long-lasting erections. Sickle cell can block the blood vessel in the penis, which can lead to impotence over time. Deep vein thromboyance. These are some big ass words. I'm sorry, dogs. I'm not very good at reading these. Sorry, dogs. Sickling of red cells can cause blood clots, increasing the risk of a blood clot lodging in a deep vein or a lung. Either can cause serious illness or even death. Pregnancy complications. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriages, premature births, and have low birth weight babies. Preventions. If you carry the sickle cell trait, see a genetic counselor before trying to conceive. Can help you understand your risk of having a baby with sickle cell anemia. A genetic counselor can also explain possible treatments and preventive measures and reproductive options. Alright guys, that was a more like a rare one, I would say. If you guys know anyone that has that, or you may have that yourself, just keep fighting strong. I love you guys. If this has helped, make sure you share it with friends, your family, just so everyone can be on the same page, kind of. I know I butchered most of these words, but if I did, I'll just put up on the screen so you guys can sound them out with me. Or if you know, I'm not a doctor by any means, but I just want you guys to be safe and healthy. I know it's not always the case, but if I can help anywhere I can, that's my job. You know what I'm saying? I love you guys. Stay safe. I will see you in the next video.